Thank you. Come over here, Kelly.
I tried.
You are going to speak. Good afternoon and welcome to the Rath Building as we announce the completion of the 2023 annual report by our Office of Health Equity regarding health equity in Erie County, a very comprehensive report. I'm pleased to be joined by our Deputy County Executive, Lisa Chimera, as well as our Health Commissioner, Dr. Gail Burstein, who you'll hear from very soon. We are also joined by the Director of the Office of Health Equity, Kelly Wifford, and you'll be hearing from Kelly as she'll be talking a lot more about this report, what it means, and actually what we plan on doing with it in the future. We're also joined by Legislator Howard Johnson, who's been a key advocate for ensuring health equity among our residents in Erie County. And we're joined by Reverend George Nicholas, who's been an advocate for quite some time and is one of the co-chairs of the Regional Health Equity Task Force, and I thank him for being here. We know, and we've known for some time in Erie County, that there are health equity, health disparity issues. Discrepancy with regards to the availability of health care in certain communities compared to others. And it's all over the county. It's not just an issue that relates just to the city of Buffalo. There are health equity issues in our rural areas, there are health equity issues in our urban areas, and there are health equity issues in our suburban areas. And so a number of years ago, we created the Office of Health Equity. And I want to thank Legislator Johnson as well as Chair Baskin for their strong advocacy in creating not only the office, but ensuring it's a permanent part of county government by putting it in the county's charter to address these issues of health equity. We really saw these disparities, especially during the COVID-19 pandemic. There was no doubt about it. We created the office. Kelly was asked to start beginning it, and then we had the horrible mass shooting in Buffalo and the issues associated with the health disparities that exist, especially with mental health services, but also just provision of fresh food. And so the Office of Health Equity was given a lot of tasks, some of them that we hadn't anticipated when we started the idea, but they've delivered on those tasks. And I want to thank Kelly and her team, and of course I want to thank Dr. Gail and her team for the work that they do to ensure that we're providing the best that we can with regards to health access, health services in our community. This all comes down to our basic themes of our Live Well Erie program, which is to ensure everyone lives their best life possible, from the youngest child, the newborn, to the oldest adult. And to do that, you need to have a strong understanding of what's actually happening in your community to provide the best health care possible. And that's what the Office of Health Equity was tasked to do early on, was to determine what's going on in our community, how we can address those issues, and then come up with the resolutions to ensure that we provide a better community for all. And this is not just an Erie County function as Erie County government. It's also a function of all our partners, and our Live Well Erie partners as well as our health equity partners, and that's why I'm pleased that we're joined by Reverend Nicholas today, because his group and the related groups have been working on this for quite some time. We can't do it on our own. County government can't do it on our own. The not-for-profits can't do it on their own. The organizations that exist can't do it on their own, but we can do it together. This reminds me a little bit of earlier today I did a press conference out at the old Bethlehem Steel site with the Renaissance Commerce Park, and for many decades it just sat there vacant, and people said it was too big a project to take on, and you can't get it done. Well, we worked with our partners in state, federal, local government, and now we have a vibrant economic development site that a number of years ago people said would never happen. And it happened because we came together as a community to address the issue and solve the problem. So just like we did that issue with regards to economic development, we are doing that issue with regards to health care and the delivery of health care in our community to ensure that everyone has access to high quality health care and they can lead their best lives possible. And what it requires is some heavy duty examination of what's happening in our community. And that's what the vast majority of this report talks about, and I'll leave it up to Kelly to talk a little bit more about that, as well as Dr. Gail. But I just want to thank all our partners in the Department of Health, the Office of Health Equity, for the work that they've done, they've put in. This is a comprehensive report. This is not something that's just going to sit on the shelf. Those of you who know me, when we've issued reports before, I've said, if we issue the report and then it sits on the shelf and collects dust, it was a waste of time. This is not going to be a waste of time. This is going to be something that we needed to do to determine what's happening in our community and as a result of it, how we can deliver better health care. So I want to thank everybody who is involved in this process, because this is just 1 year. This is going to happen multiple years, but you got to start somewhere, and this is what that report does. It really starts to lay the groundwork of what we need to know and what we need to do to create a better, more equitable health care system for people in our community. So with that, I'd like to introduce our, well, we also have another guest that just walked in, our chairwoman of the legislature, April Baskin. As I noted earlier, Chairwoman Baskin has been a key instrumental partner, along with legislator Howard Johnson, talking about these issues with regards to health equity and the creation of the Office of Health Equity. So I'd ask both my partners in the legislature right now, Chair Baskin and Legislator Johnson, to say a few words. So.
Thank you.
I'll be brief because I love it when the chairwoman comes. I would say ditto what she says. No, but what we recognize in our minority communities, when other communities get a cold, we get the flu. So it was when the chairwoman brought this up of establishing this office, I was proud to partner with her to make sure this came through and came to fruition. So just want to thank the county executive administration, Dr. Bernstein, Deputy County Executive, who was with us as we rolled this out. Dr. Wolford, I'm sorry, Kelly Wolford,
That's
and
right.
Pastor Nicholas as well for being here, who helps address some of the health equities here. I want to thank you guys for all your hard work. I think this report is going to touch on a lot of the things that we already know, and we just need to get to work. So thank you.
That's right. Thank you. Ditto to what Legislator Johnson said. Thank you all for being here today. And we know that our county has faced its health challenges, from lead poisoning because of our old housing stock to our recent cancer cluster on the east side of Buffalo. And we also know that marginalized communities and people of color from minority communities always have been denied access to fair and equitable health care. And during the pandemic, it became painfully obvious that healthcare outcomes differ from community to community. And because of that disparity, Legislator Johnson and myself, and at the time, Legislator Shamira, now Deputy County Executive Shamira, and in conjunction with our majority caucus, we worked hard to pass a bill in the legislature to establish the Office of Health Equity. And so to be here today and celebrate this amazing report and their hard work under the direction of Director Kelly Wolford and her wonderful team. I see some of our team members are here today. We are truly, truly appreciative. I also want to thank Reverend Nicholas for his hard work in the space of health equity, even prior to the pandemic, just bringing knowledge and information to the community to expose those health disparities that marginalized communities and people who come from low economic backgrounds face. And of course, to our county executive for supporting this piece of legislation and actually bringing it to fruition. We just had another press conference about an hour ago, and I said, so I'll say it again, I said it then, I'll say it again, because this is another example. It's one thing to just have a county executive who has a vision, but it's another thing to have Mark Polencars as your county executive, because he puts his vision to action. We have outcomes with his vision. And so we had a vision for an Office of Health Equity, and because of the leadership of the county executive, we have this amazing report, we have this amazing director, and we have this amazing team that is actually researching the disparities of marginalized communities and bringing forth access and different types of resources so that they can change their health outcomes and have full and lead full lives. So thank you again, County Executive. Thank you, Legislator Johnson, for your partnership, and I'm very happy and proud to be here today. Thank you.
Thank you, Chairwoman. Appreciate your kind words. This would not have happened without the strong support, of course, of the folks in our Department of Health. And it is my pleasure to introduce to the podium, after I fix what we affectionately call the Gale step.
I'm still short.
Yeah, I'm sorry. But it helps. It helps everyone to see our incredible health commissioner, who's worked through so many difficult things. I think neither of us expected some of the things that we've dealt with during this administration, but she's been at the forefront, and I'm very proud to have her leading our Department of Health, our Health Commissioner, Dr. Gail Burstein.
Thank you. Thank you. Oh, I can see you all. That's what you look like. So thank you again. I'm Dr. Gail Burstein. I'm the Erie County Department of Health Commissioner, and I'm a pediatrician. And what I'm going to do today is going to frame, what's in this report, how we got there, and also highlight like some of the jewels that we have in our Office of Health Equity. So this is really a monumental piece of research. It represents countless hours of survey design, data collection, focus group session, and the analysis to bring it all together so it's something digestible, and then we can all use this in our work. So this report is also a fundamental piece of research, one that we can use as a county to more thoroughly understand the structures and systems and where people live and work in our community. So the successes of many of our innovative programs are featured in this report. So if you haven't heard about our programs in the Office of Health Equity, like the Mental Health First Aid, our Children and Youth with Special Health Care Needs, or SHIN for short, because it's a long name, our Grants Technical Assistance, or our newsletters collection, now is the time to learn about that, and you can see about that in one of our posters. So just to highlight some of the successes of these programs, so we certified over 700 people just this year in our mental health first aid. In our SHIN lead, Ivana Ramos, she developed such a robust program, then also like all the other local health departments in New York State are regularly asking her for technical assistance because her program is just so productive. Our grants coordinator supported 18 organizations and accessing over $3.5 million in funding and counting with technical assistance. We expect to see more come in this year. Our newsletters earn recognition from the New York State Public Health Association and are widely used resources in healthcare and human services throughout Western New York and beyond. And so I see this for our press conference, and this report will inform local efforts to identify root causes of systemic inequities. And one way we can understand those systems challenges is by examining the social determinants of health around economic stability, built environment, healthcare, education, social and community context, and language access. And that is all in here in this report. And so we know those factors play an outsized role in health outcomes, even more so than genetics. And they have a major influence on health behaviors. So this report shows how people, real people here in Erie County, including us, interact with systems that have a fundamental impact, positive or negative, on their health and quality of life. So with that, I'm going to turn over this press conference to Kelly Wolford, who is going to actually tell you the meat and potatoes, actually with the content of this report, because again, it is so important to us as we do our work this year and in the future. So Kelly.
Thank you.
Probably don't need this.
I've always wanted to be over 6 feet, so I don't mind using stuff. I'm here for it. Good afternoon, everyone. I am Kelly Marie Wolford. I am the inaugural director of Erie County's Office of Health Equity, and it's an honor to be in this space doing this work. I'd like to say thank you to our county executive, deputy county executive, our chairperson, legislator, and my boss, Dr. Gail. And Pastor George, who you'll hear from after I speak. This is a all-hands-on-deck issue. It goes beyond me, it goes beyond our office, and this report allows us to be a resource for community members, corporations, healthcare organizations, governments, to be more equitable in their work and their approach. The report is 324 pages long. It is not meant to be like your weekend reading assignment. It can be, if that's your thing, but our purpose and our approach and our goal was to create a document, one that by law we need to summarize our work, and we've done that in the book, but about 224 pages of the report is our survey, the Community Wellness Survey. How we got the answers, how we developed the questions, where we went, who we spoke to, how we put the pieces together, not just in developing these 324 pages, but how other organizations, other areas within Erie County government, other groups, be it a block club or a corporation, can be more equitable in their approach so that what we do lives on and can be duplicated and replicated throughout Erie County. I totally veered from the notes on the piece of paper, and for that, I do not apologize. I stand by all of my words, but I just want to talk about the health behaviors piece. So often we say people need to do better. People need to eat better. People should. They should. If you wanted a better job, go get a better job. Well, if you weren't so fill in the blank with a statement that's not relevant for all people, then perhaps you would fill in the blank with some goal that really is not attainable for all people. And so what we did, when you look at these posters, you will be able to see how the work overlays and overlaps. We took an approach of looking at the social determinants of health, which boiled down to if you did everything in your power, all the advice that the doctors gave you, you did all of the things that you were supposed to do, it would only account for 30% of your health. I have never taken a test, gotten a 30%, and passed. So how do we then equate that percentage to life expectancy? It doesn't work. And so this upstream approach of approaching that other 70% is what this report does. It understands the life choices that people have, but it seeks to illuminate that 70%. Not just why, but why in the words of the people. We went into communities throughout Erie County. That is not up here, but it is in the report. We touched all of the zip codes. We went into every community. We were in rural Erie. We were in urban Erie. We were in suburban Erie, listening to the people most affected by health disparities. We so often put information out there and say, well, what did the people say? Well, only the people that heard the question and have the ability to respond tend to respond. Those folks generally are not the people that you want to hear from. So my staff went out into communities. Eddie Payne is here, he's one of our educators, and he literally went out to community gardens, to door by door, or like the door to door work, asking the questions of the people. We partnered with the Buffalo Center for Health Equity and the Witness Project for them to be able to go door to door in a way that people receive them. I believe I can go anywhere, anytime, and people will say hi to Kelly. I believe that is not actually what life shows us. And so we needed to be able to show up for people in a way that they were receptive to receiving from us. We are the government. And so how do we as the government show up for the people? Because we are also the people. So this report seeks to understand, it seeks to illuminate, it seeks to give us an opportunity, no matter where we fit, no matter where we sit, to do the work in an equitable way. If the Office of Health Equity had the staff of the Department of Social Services, we could not fix equity. It has to be an all-person issue. It has to be an all-person solution. And with that, because I will stand here and preach all day, I am going to say thank you. Thank you to you for sharing this space and time with us to learn more about inequities in Erie County. And feel free to reach out to us in order to learn more about the work that we do. And on July 17th, we will have a webinar that really dives into the work. It dives into the sections of the social determinants of health so that we can all walk away with a better understanding of how we all can address those options that people have. So when it comes to their decision making, they have better options to choose from. Pastor George.
Good afternoon, and let me again just echo the sentiments of all the speakers. Just thank you so much for the leadership of the county executive, the leadership of the county legislator, especially President. See, I'm already calling you Senator. Chairwoman Baskin and Legislator Johnson, and certainly Dr. Gail Birdstein and the entire team. I want to just thank them so much for listening. You know, this report here is going to be a very important and is a very important tool to bring something that is a human right for every individual. This is not just about citizens' rights. This is about human rights, because every human being has the right to live a healthy life. And I'm so grateful today that now we have some data, some information that proves that there are these tremendous disparities that exist within our communities. But the solution cannot be found only within the healthcare system. The solution is found within every system. The social determinants of health are what drives these poor health outcomes, not only in the African American community, but also in rural communities and any community where you find disparities. So my invitation today is this, and I urge leadership. Leadership in the Buffalo Club and corporate America, corporate Buffalo, leadership in education, leadership around housing, and leadership in every element of our community to get this report and then see what role they can play in order to bring health equity within this region. If we continue to have children that are 3 and 4 grade levels behind, if we continue to put people in substandard housing, if we continue to have entire communities that are underemployed, then the goal and the desire and the hope of having health equity will never be obtainable. So I'm so grateful today that we have the tool and that we have a working group of folks, and I invite other levels of government. The county government has been a leader. The county government has been very responsive to our call from the Buffalo Center for Health Equity and the African American Health Equity Task Force to look and address these issues of health disparities. So now we need every level of government, federal, state, county, city, school boards, every level of government to take this report seriously and make a commitment, make it a priority to do their part to bring health equity to this region. There is an African proverb that says, in unity there is strength, and in division there is weakness. We can come together as a community across all kinds of differences, whether it's ethnicity, whether it's class, gender, whether it's even Republican and Democrat. And we can, if we so choose, to work together to make sure every person in Erie County has the opportunity to have a healthy and productive life. Thank you, Erie County, for showing this leadership today. Thank you.
Thank you, Pastor, for those kind words. Pastor Nicholas and I had a lot of conversations over the years.
Yes.
And I told you this is not going to be lip service. We're actually going to deliver it, and I'm very proud we are the leader with this great team that we have here. And it took everyone. It took the legislature. It took the Department of Health. It took the creation of the office, including in one of the toughest times our community has ever seen. And here we are today with this very important report, which is going to set the standard going forward. So I want to thank all of them. I also want to thank Lee from Deaf Access Services for providing us the American Sign Language today. Thank you for doing that. And with that, I'll open up to any questions from the members of the media. Yes.
I know that this office was founded in 2021, and then in 2022 we saw the Tops mass shooting, which kind of put that community under a microscope a little bit. And when we look at some of the data here, we do see the disparities that hit that community and have always been there. But my question is, how has that experience informed this office and or impacted your services?
Well, I'll briefly offer my opinion and then turn it over to the others. We always knew that health equity disparities existed, and there were problems with health equity in our community, and that's why the office was created. It was magnified to the rest of the community in that situation there. I mean, I would go around other parts of the county, including in some of the suburban areas afterwards, and we were focused on food delivery and mental health delivery, and I'd hear from people in other communities, it's like, I can't believe there's just one supermarket that actually services that entire zip code or that area. I go, yeah. And in many areas, there's not a doctor's office. That's why we created 1500 Broadway, the Erie County Health Mall, because there wasn't a doctor's office in that zip code. And it's been out there. it was magnified so the public understands it more. And it made it truthfully a lot easier to support this office, as in may have been in years past, because people understand that the need exists. So what it did is it just showed to the rest of the community who may not have understood what actually existed in parts of our county. And it's all parts of the county. I mean, I'll hear it from people in the urban areas as well as in the rural areas, that there's health disparities and health inequity in the rural areas. So I think it just showed to a lot of folks who don't even think about this issue on a daily basis that these issues do exist, and their neighbors who do not live that far away from where they are live in almost a different world. And that's why it was important in some ways to get that message out that we're working on this. We had to change our plan during that point. We really, the work that we wanted this to be done, so it would have been issued sometime in '22, had to be put on the back burner because the most important thing was servicing the needs of the community that was in significant distress. But here we are today with this very important report, and I do thank Kelly and her team for all their work. Anybody else want to talk about that issue?
So here's the thing. The Black community and the east side of Buffalo, the folks that were directly impacted by the massacre at 514, it's easy to say that that was the impacted community. But that community is our community. The reason why 514 was possible was because we think they are not us. We are them. And so as long as we continue to believe that they need help or they have a problem, that we don't need help, that we are not the problem, we can't be the solution. It's always gonna be a them thing. Whether it's a Black them thing, a tall people them thing, whatever group you wanna, until we can say us and really mean that will always be possible.
You know, there's a tendency to blame people for their conditions. And so if you can fix blame upon a person because of something that's terrible that's happened to them, then you can absolve yourself for any responsibility to help that person. I think what happened in May 14th was it really showed that, you know, terrible things happen to people who it was not their fault.
Right.
Well, it's not your fault to have chronic diabetes and chronic hypertension and all these other things that plague people in these communities. Now, are there things that you can do to address these things? Absolutely. But the lived environment is what drives so many of the poor health outcomes in these communities. So instead of just blaming people for their condition, we have to come together as we did after May 14th to try to help people, to try to help them, and try to put them in the positions where they can help themselves. But we have to come together to do that.
Any
I was wondering if it was a situation in that survey where you found some folks out there that just never have a chance to go to the doctor, that can't go to the doctor, and wondering how much more maybe they could bring into the communities. I know they do like the mammogram, local fam, things like that. Is that what we're kind of geared toward for this too?
So health access is an issue, right? In every health outcome, every topic that you consider and look at, there are layered issues there. The solution is complex, but it's not difficult. If we begin to, so the short answer, yes, is the answer, the short answer. But how do we go about meeting people where they are? And even if you build another hospital, can the people get there? Do they have the PTO to be able to take off and go for a well visit? There are rules and laws in place that say an employee can do this thing, but when it is implemented, do they have the other pieces needed? I can take off for a cancer screening, but can I leave work and get to the doctor and be back in time to finish my job? Can I also go get my children? Can I also take care of, my elders? Like, it's layered. And so, yes, and we all need to be able to do our part in these other spaces so that when the health mall is fully staffed and functioning and ready, that people can get there, they are able to then get to a pharmacy. Pharmacies are closing left and right. Like, where do you then go to get your medication without then being blamed by the healthcare system because you didn't go and get the medication? Maybe you got it, but then you started to take it and now there's side effects. Well, I have to be able to get to work and function. I can't afford to not operate heavy machinery because that is my job, to operate heavy machinery. So then we can't go to a blaming space and place because people, even if given the access, still aren't able to live their best lives, a whole life, a healthy life. So yes, and.
Yes. And if I could just add one piece into it, I think the one piece that, we haven't really touched on is the trust factor. Trust in that the healthcare system is going to do right by us. Trust in that people who don't look like us is going to be responsive to our needs. I know one of the biggest things that we face as an obstacle during the 514, it was probably already prevalent before then, was that when they established the Resiliency Center at Johnny B. Wiley, the one thing folks asked for was people of color that look like them, that can talk to them for the mental health piece. So I think one of the bigger things that, should be highlighted is the trust factor.
Yeah, I'll give you an example of that where we learned on the fly, making our mistakes after 514 was send mental health counselors in the neighborhood because so many came to volunteer and they predominantly were white. And people didn't want to answer the door because they just had a white person drive 200 miles to kill as many African Americans as they could. I don't blame them. So we learned very quickly we need to get people of color, people who look exactly like some of the people in this neighborhood who talk the same language, multiple languages spoken in that neighborhood. Not just send, and you don't want to turn people away who are willing to help, but you also need to understand that there are things beyond what we normally consider in a circumstance that have an impact on whether someone is going to answer that door, whether someone's going to go to that facility. And we're still learning. That's the nice thing about this is we're learning things that we didn't know before that we're now going to be able to examine and create a better community as a result of it. As I say, I don't want our departments, our offices to do reports just to issue reports. That's a waste of time. If we just do a report, issue a report, and then we walk away and say, that was a great job, and never do anything as a result of it, well, why did we do the report in the first place? The idea is, what can we learn from this to create a better community for all? And we got a great team working hard to ensure that we will create a better community for all, and it does take the entire community, as was noted, not just Erie County government, but all our partners. Any other questions?
Yeah, one of the social determinants of health that's identified in the report is language access, but you vetoed a bill earlier this year that would have expanded language access in the county. Could you kind of square that circle for me? Is there anything that, the county government is doing to address that further?
Yeah, we're having ongoing discussions. I think it had a lot to do with what I felt were inconsistencies between what was federal law, state requirements, and what we would require in county government. If you know what the Office of Health Equity is doing, I mean, the newsletter, all you gotta do is pull up the newsletter. The newsletter's in how many languages? 6 languages. It is available for the primary languages. And what's interesting is sometimes some of what people consider as the primary languages in one community is not spoken anywhere else. So you have to address it in other ways as well. So the discussions that the chairwoman and I have had are not that I do not want to see an expansion of language access, which there is a lot of language access in county government already. It's just that we do it right so that we don't have inconsistencies elsewhere.